welcome to the medical aspect of Cat Chat. I'm here with Dr. Molly Welly from Quick Fix, where we work together every day.
Yes.
Well, a lot of days.
Yeah,
several
days.
A lot.
Yes, a lot.
And we're here today to talk about some of the things that happen to kittens. Our subject today is eye issues. And we have two kittens here. They're actually not related.
No. They look alike.
And they're at different stages of their eye problems.
Yes.
These are, in my opinion, most of the time, this is totally preventable.
Yeah, when you have a lot of cats living together, unfortunately, a lot of cats will get exposed to herpes virus, which can cause the ulcers in their eyes, which can lead to them having to have their eye removed, like Ivan. But if you catch it early enough and you treat it well, the right way, then hopefully it doesn't have to get to the point of Ivan.
Right. Ivan is spelled
E-Y-E-V-A-N.
E-Y-E-V-A-N.
Yes.
We're so clever here. And then we have Scruffy.
Yes.
They're both crazy kittens. They are both up for adoption.
Yes.
I've been fostering him since you saved his life.
Yes.
You literally saved his life. And they said it couldn't be done. We had a rescue that comes in every week, and they called me up in the morning and said, Wendy, we have two kittens. One of them has a severe eye issue, and it was bulged out of his head.
Yeah, it was ruptured.
It was ruptured. It was mortifying. It always is to see that.
Yeah.
And it's very painful, I'm sure.
Oh, awful. Yes, painful.
Very painful. And they said, we've had these done at full-service vets. None of them have ever made it.
Yeah.
But can you give it a try? And I'm like, my vets? Oh, yeah. I said, absolutely, we'll give this a try.
Yeah, thank God we did.
And an eye removal is called an
enucleation.
Enucleation. And so we've done plenty of enucleations. Because sometimes when we get kittens in at Kitten Crazy, they come in this state.
Yeah.
And so I said, Dr. Molly, and you put on your Superman cape, and here he is today.
Yes, looking great.
Can you just explain, start to finish, where does herpes come from? How do they get it? And then how does it progress? And when can people, I know there's a lot of questions in here, but how can people stop this from getting to that point?
Yeah, so herpes virus is a virus, obviously, that's spread pretty easily from cat to cat. So it's more common in situations where there's a lot of cats living together. There is a vaccine for it. So that's one of the most important things, is to keep your cat or kitten on a good vaccine schedule to prevent the herpes virus. If your cat does get exposed to herpes and does end up with an upper respiratory infection, which would include like snot, sneezing, fever sometimes, and then the other thing that it can cause is ulcers in their eye. So an ulcer is a scratch in their cornea, which is the outermost layer of their eye.
And you can tell because it goes like fuzzy.
Yeah, it looks, and they'll blink because it's really painful. So they'll blink, their eye will look red, and then sometimes they will get edema in their cornea, which will look kind of like bluish fuzziness around the ulcer. The only way to really tell is to stain it. We have a special stain that we can put in their eye that is absorbed by the layer under the cornea, and then we can shine a light on it and it'll shine green. That tells us there is an actual tear in their cornea. And so those can get bad enough where their eye, like Ivan's, can rupture and the inside of their eye comes out the scratch. And at that point, there's nothing else we can do. But one of the most important things is to use to keep their face really clean, because the discharge from their eye when they do have an ulcer or conjunctivitis can irritate the skin really bad. They can make their hair fall off and irritate the skin. So cleaning their face several times a day.
With warm water.
Just warm moist rag. And then obviously getting them to a vet right away for an antibiotic ointment in their eye, just a triple antibiotic. The one thing you don't want to do is put any sort of antibiotic in their eye that has a steroid in it, because steroids could make the ulcer worse.
So right now, let's just take a look at Ivan and his scar, which is really hard to see because of the coloring in his face. So I don't know, Andy, if you can zoom in here. It doesn't even hurt him.
No.
And like I said, I've raised Ivan for the last month. He's just an awesome, he loves dogs.
Yes.
If you have dogs that won't eat cats or a kitten, this kitten, I have 5 cats and 2 dogs, and this kitten loves the dogs. And I bring in pictures all the time and go, look at Ivan, he's sleeping with the dogs. Look at Ivan, he's playing with the dogs. And I'm sure you guys are sick of it, but this cat loves dogs. So if you have a dog that might like a companion cat, He sleeps with them, he plays with them, he eats with them. So he's ready to roll. I'm going to let him go. This is the one I want to talk about right now is what point are we at with his eye? Because we've been treating it at Kitten Crazy for a while under your direction.
Yeah, so he had, his eye was hard because his conjunctiva got so swollen that I couldn't really see his eye.
Yeah.
So I just had to assume that he did have a corneal ulcer without staining it. And then we've been treating it with a triple antibiotic. Probably at this point going to have to enucleate it because I didn't see it, but I had heard that his eye had gotten really swollen.
Yeah.
And then went back down. So he probably did have a rupture in his cornea as well, so we'll have to enucleate his eye.
Okay. And then, you know, with Kitten Crazy, it's funny, when they have a deformity, they're some of the first kittens that go home.
Oh, yeah, I'm sure they are, yeah.
And there's nothing that's going to happen to them bad going in the future. There's no other, they just have one eye.
Yeah.
And Ivan's doing phenomenally. He's just a phenomenal cat. Sometimes we use this, terramycin. So if you go to the vet and they prescribe terramycin, that's a great thing. We find that it's good.
Yeah.
So so for our 5-minute segment today, what we want to say is keep the face clean and get to the vet.
See a vet right away, yeah.
Because otherwise, literally, we've seen those eyes pop out.
Oh yeah, they can lose both their eyes.
Monstrously.
Yeah.
And it's not pretty and it's very painful.
Yeah.
So, all right, that's it. Thanks for watching the vet segment today.
Yes, thank you.
Thanks, Dr. Molly.
Yes, thank you.